Tung tung, I love you. So we say women are auditory. Why then we are not using real life in real life? All those healthy things which are there. Of course, that is going to increase the pleasure. Okay friends, so after listening to the 2 days to all the speakers from Raj Brahmabhat to Kavaljit, I would ask you, how is the Josh? अरे भाई ये डॉक्टर लोगों का जोश है और होश है, जरा और जोर से, हाउ इज द जोश? ये सेक्सोलॉजिस्ट का जोश है, होश है और मदहोश है. एक बार लास्ट, हाउ इज द जोश? And what did we do right now? Well friends, this is something called as enthusiasm. Yeah, the word comes from en is inside and theos meaning God, that means giving the divinity, that means whatever energy we are having. जो भी करना है वो दिल से करना है, मन से करना है, and giving 100% to whatever I am doing. It is an attitude, enthusiasm is an attitude to celebrate. Why only ceremonies and functions, but also life? And why only life, but also sex? Yeah, so sex is a celebration and it is basically taking a delight in whatever we are doing. And the thing is that enthusiasm, whether of the personality or sexual, is infectious, contagious in healthy sense. It gets transmitted, and hence the first nakshatra I would always say is sexual enthusiasm. The second is epitome of sexual experience plus expression. Joy has to be projected on sex and partner. What is that? Epitome of experience is something called as taking pleasure in small, small things in life. A butterfly, wow, how beautiful it is. Ye choti si bee, oh, how beautiful it is. Madhumita madam, you are so graceful. Wow. Handsome Paras, so nice. So what is that? That is appreciation. Taking pleasure, deriving pleasure from all walks of life. And I personally feel that unless and until our personality changes, our sexuality doesn't change. Because sexuality is a subset of personality, and sex and mind are two sides of same coin. And so sexuality and personality are also two sides of the same coin. And sex is the only act in our life where we are experiencing and expressing at the same time. There is no other act where both the things are done simultaneously. And why people can't enjoy? Because they are not open for experience. Jo kuch bhi hai, okay? So that is called as an epitome of experience. Gulab jam kha rahe ho to, wow. Sunset to wow, kya sunset hai yaar. So similarly, oh, how gorgeous you look, how beautiful, how sexy, and that is what is required. Time for sex and togetherness. How can quality time come if quantity is not there? Because quantity can only breed quality. And the thing is that I very much believe and I have experienced that unless and until the patient makes his sexual problem as a priority in life, things don't change. Because only when we value a particular thing, make it a priority and make it a decision that yes, I want to improve my sex and I devote myself to it, then only the things change. So devotion of time, energy and resources. Enhancement and enforcement of pleasures. More and more area of the brain is recruited. And how that can be done? Well, it's like a cephalic phase of sex is like that of the deglutition. तो जैसे हम वो मैरिज में जाते हैं, so they throw the essence, मोगरे का गजरा रहता है, and beautifully displayed that Rangoli and Rukhwat is there, and the nice display of the food that stimulate, and food and sex go very much parallel. So that stimulate. Whatever salivation will be occurring from the mouth, exactly the same thing happens. Ejaculation and lubrication of vagina, what is that? And what, actually if you see, the food and the sex, they actually go hand in hand, they are in parallel. Pleasurable settings and stimulation of mind, brain and senses has to be there. And for that, the environment and ecosystem should be sensuous and romantic. If Amitabh Bachchan was a sexologist, he would have said to his client, वसंत ऋतु की तरह शैया और शैया घर, शरद का चांद हो आदमी, शुक्र की चांदनी हो औरत, वर्षा की प्यार की नमी, ग्रीष्म की गर्मी, शिशिर की गुलाबी प्यार की ठंडी और हेमंत के पत्तियों जैसी बदन में सरसराहट. And then he would have probably told his client, अगर तेरी गर्लफ्रेंड होती तो ऐसा होता, अगर वो सेक्सी होती तो ऐसा होता, तू और तेरी तन्हाई अक्सर ये हस्तमैथुन करते हैं. So stimulate senses with the lingerie, nightgowns, mattress, curtains. This is the bracketed things are, that is what we should tell our patient. Charles Darwin and Yash Chopra approach. Why striptease and nude show if the partner only does for the spouse? No need to go to Thailand, yeah. And what Charles Darwin, if you see that right from the insects to butterflies to fish to birds, there is a great display of colors, and that is evolutionary, that is to attract the mate. And the same thing, adornment, decoration, beautifying the self, aesthetics is nothing but attracting others. And that is our duty. And Yash Chopra approach I call, because in his film, in his song, for every song and for every verse, there are exotic locations with beautiful bright colors. Even pollination, okay, flowers are usually red, yellow and orange to attract the insects, because yellow, orange and red lie towards the infrared spectrum, that is the heat. And heat is nothing but kinetic energy. It goes to the physics, okay? And that is what we say, sexual heat in a positive sense. For your eyes only, don't take it so lightly that you are doing it in the dark. So many people, so many couples happen to do the sex in the darkness. How can they enjoy? भगवान ने इतना सुंदर नग्न शरीर दिया है एक दूसरे का एंजॉय करने के लिए, और शादी तो उसी के लिए है. It's a license. It's an official thing, isn't it? So, because many people, they do the sex in the darkness, and that's a problem. They won't be getting stimulation. Effects of sound for sex, erotic music, sensuous instrumental tunes. Tung, tung, ding, 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 ding. I love you. So we say women are auditory. Why then we are not using real life in real life? All those healthy things which are there. Of course, that is going to increase the pleasure. Essences, aroma, oils, fragrances, perfume, scents, because the olfactory lobe is directly near the limbic system. And what that the couple should start with we all know that the first is the massage. Now IIT couples are there, both are working, both are having stress. तो घर पे आए एक दूसरे को बहुत ही अच्छी तरह से बैकअप दिया, बैकअप मसाज दिया, genuine, convert that into sensuous massage, convert that into sexuous, and then go into the genital massage. Erotic touch and leak, wet sex, wet clothes, wet body, wet genitals, and this is how the sex should be enjoyed. And well, friends, apart from brain, the most important organ is skin. Because ultimately, what is sex? Sex is nothing but touch. It is the highest and the deepest level of touch. Touch of the vaginal skin with the penis skin. And it has been proved beyond doubt that animals we have seen that they lick each other, and there are many references now which are coming that if the licking and the kissing is done, then, which is an epigenetic factor, okay, and Richard Dawkins, who has written something called as an extended phenotype, okay, a beautiful thing. All these are dress and all this is our extended phenotype, okay, exoskeleton. The dress is exoskeleton. So what I was talking is when the leaking is done, it has been proved that there is something called as a methylation of the DNA. Methylation is monstrous, demethylation is good. And there is something called as acetylation and deacetylation of histones. So acetylation and demethylation, which is good, gets stimulated, okay, the cystosin amino acid base, and it is because of that there is a downregulation of the receptors at the membrane level of the cortisol hormone. And that is very helpful. So that should be done, and the test has been done in the rodents, in the mice, and in the puppies. Curls, curves, moisturizers, detanning agents, hair conditioner. Skin is the ultimate largest sex organ. Next is the tongue. And I told you leaking genetics. And well, I would request all of you that as a dermatologist, and there are so many dermatologists over here, that protection from the sun with the sunscreen agents and lubricating the skin with the moisturizer 4 times in a day. And whatever we are talking is applicable to us and our sexuality as well as the sexuality of our patients or clients. And if we moisturize, the erotic sensuous stimulation of the moisture skin increases. More, because dry skin withers, the free nerve endings, they become anesthetized. So when the moisturizer is there, and sex is life, and sex and life is what? Water. And 80 to 99% of keratinocytes are with water. So more and more amount of the free nerve endings and other corpuscles and this and that is recruited to stimulate the brain. So simple use of moisturizer. Why only lubrication of the skin? Do lubrication of the entire body. If you have seen the skin which is moist, beaming, glistening, that is more erotic. And as I said, the curves and the curls, whether it is of the breast, of the buttocks, or of the hair, that is more stimulating. Techniques which we always see, positions, foreplay, afterplay, where action horse leads the cart of sex and motivation. Again, are you open to participate? That is very important. People are not ready. So what I want to say is that, of course, wherever passion is there, automatically motivation comes. But if the passion is not there, we have to tell, and all psychiatrists would agree, that it is the action that finally motivates to do the thing. Because if you say that horse is an action, then the buggy or the cart follows that. And buggy or the cart with the sarthi is a motivation. Only when the horse will start, that is the action will start, motivation will automatically come. And that is, it is said that act as you want to feel, and then you will feel as you act. And that's the truth. So do sex at variety of places. Why only bed? But avoid exhibitionism pleasures. Afterplay is foreplay after play. I would say that, so the sex has become, or even the sexology, we should not become sexist in the sense that the patients have this in mind that after the erection and ejaculation, ho gaya sex. What about women? So afterplay will, even though whether it's a premature ejaculation or erectile dysfunction, the husband can continue stimulating his wife. So the afterplay for him will be consisting of foreplay for his wife, okay? And that's why, and still then he can continue. Because as regards touch, see, history repeats, okay? What does a parent parent do to their infant, they take, they cuddle, they kiss. छोटा नन्ना बच्चा रहता है, पूरे बदन को का किस लेते हैं. We have done with our kids. Okay, so right from the bottom of the top of the head to the bottom of the legs, the parents go on kissing and cuddling, and the infant gets the message that I belong to someone and somebody belongs to me. Of course, when the parents are doing that, the intention is not sexual, and as I said, that in human beings, references, context change the meaning, as well as the intentions change the meaning. But see, the same thing gets repeated between the spouse. Same type of cuddling, same type of kissing from top to bottom, but now the intention is sexual. So I think a person gave a talk as regards the rural women. तो रूरल वुमेन को बताने का है कि अरे बच्चों से जैसा प्यार करते हो वैसे ही हस्बैंड से प्यार करना तू. And I was talking as regards the action. So we say that yes, it is true evolutionary that women they go from emotion to sex and men go from sex to emotion. But after a while, if we start having cognition, I would say that from a rational emotive therapy point, the women start giving emotional reasoning. I don't feel something for my husband and hence I am not doing the sex. And it is difficult for a woman or किसी को भी प्यार हो जाता है, बराबर. But what about sex? We can just take the body and keep it on the bed and sex can start. Because the body is the instrument of the mind. 15 minutes. Pillow talk. Post-sex, this is very important, as many people have told, that after the sex, the husband and wife go in 36 position and they start snoring. So instead of that, they should have 63 cuddles or cuddling, and after 69 happy endings, that means position. And the thing is again, that what is the acid test that the couple, they have a love between each other, if they are doing after play, and if they are, as you told Kawaljit, that वो quilt के नीचे एक दूसरे को hugging करते हैं, and all the important decisions of life are taken in the bed. बच्चों का क्या करने का है? What should I do as regards my career? वो जिसे कट्टा कहते हैं, that should go on, the communication. Novelty and variety plus certainty both add to any pleasure. Novelty and variety of any things and many things. Totally satisfied from spouse, a person can also seek partners for variety, and his or her large, if he or she is having large sexual hunger and appetite, warn him or her against the disadvantages and unwarranted consequences, infidelity, probability of STD, conning, getting the victim of con, emotional blackmail, etc. Swapping and threesome. In history, now we should ask for this. Physician can say she doesn't advocate and tell the disadvantages, but this is very important nowadays because these things are used for pleasure. Sex role. What is a sex role? Do advise if accepted by the couple. So the sex role is that, okay, you become a nurse, you become a doctor or whatever, teacher, student, the partners are doing the sex role and they are fulfilling their fantasies. Okay, this is now a recognized thing. Use virtual and OTT sex. Beware of viral shoots. Okay, if the partner is not the spouse. Can use soft romantic pornography. Now this itself is a debatable without becoming addict. And if acceptable by both partners, this is a double-edged sword. Okay, only tell that after history taking. E-sex, pleasure to haptic technology. Now a technology is coming where what is happening, that a partner in Pune, the female, loads an artificial phallus into her vagina. The electronically stimulation gets transmitted or the impulses to her mobile, from mobile to the satellite, from satellite to the artificial vagina of a person or her boyfriend who is sitting in Bangalore, and from artificial vagina to his penis. अब टेक्नोलॉजी वहां तक जा रही है, एंड हैप्टिक का मतलब है टच. So this is called as a haptic technology. So technology can be used 18 minutes. Advocate use of dildos, vibrators, fingers, rimming, mutual and autoeroticism. See that it doesn't get converted into fetishism, electric shock injuries, fomite STD. Emotions and feelings. How I am motivated to have sex. See, because unless and until if the person is having so much amount of guilt and shame, shy, fear, disgust, sexual angst, hatred, sexual contempt, we all know the reasons, he or she cannot enjoy the sex. We should, for any action in life, we should be motivated with positive emotions and intentions, not with negative intentions. As I told you, and this is applying enthusiasm and all this intention theory, I myself try to apply in practice. See, because if don't even whenever we are talking to our audience, we should not intend to impress, but to express. And that is what is required. Yeah, so angst is an existential anxiety. The word is used by Soren Kierkegaard and Albert Camus and Jean Salpeter, correct? From philosophy, existentialism. Yeah, and sorry, intimacy. Yeah, so there are 12 different types of intimacies, and the most important thing is to have unconditional acceptance. Now, Thomas Harris and Eric Berne, the fathers of transactional analysis, have told actually that it is not that husband and wife or cohabitants are having troubles in their relationship because they are lacking intimacy. It is ulta. They do not want intimacy and hence they are fighting. Okay, that again tried. So sometimes they are not wanting, but they are not accepting the fact. Kitna ho gaya? Can you give me 2 minutes? Yeah, now I will these are the 27 nakshatras. So yeah, just thanks, but just telling you this important thing, kissology. We should tell that to the patient. If we happen to kiss anybody, okay, at even a social and a sexual level, both I am saying, but let us say social. Kissing on the head means blessings for you. And okay, then kissing on the forehead, uska matlab hai support and appreciation. Whatever you have done, wow, Ajna Chakra. Okay, then kissing from cheek to cheek is I like you. Kissing of the hand, oh father, oh my beauty. Okay, that is liking as well as that means respect for the person when you kiss on the hand. So every kiss has a different meaning. Kiss ko kiss karu, kiss miss ko kiss karu, kiss miss ka kiss mein miss karu. Okay, so that's just to keep the humor. Okay, but yes, and this is what we should tell, that why only oral to oral and why genital kissing, have all these kinds of kissing. Yeah, this I have told you, that pleasure. And the last thing is that rasanishpatti. Rasanishpatti in our Hindu dharma, what is that? That is nothing but a psycho-immunoendocrinology, psycho-neuro-immunoendocrinology. Psyche is the intention. Neuro, the nerves, the neuronal tracts that get fired. Psycho-neuro, immuno, they affect the immune. And hormones, samprerake, ras nishpatti. So, if we want to have pleasure in life, okay, 2 things. We should not do anything with pressure, but we should use Karuna Ras, Hasya Ras, Shrungar Ras, Vatsalya, Shanta and Adbhut Ras. वहां से सेक्स किया करो, प्लेजर किया करो. रौद्र रस, वीर रस, भयानक, विभत्स और विकृत रस का सहारा लेके बिल्कुल नहीं. Finally, as a dermatologist, I would say that I am more of a neuroectodermatologist, and neurologist and psychiatrist are my real brothers because we both come from the same neuroectodermal origin. And I only tell people as that and to my even patients कि भाई मन का स्पर्श जानने की कोशिश किया करो और स्पर्श में जो मन है उसकी अनुभूति लो. Thank you. So I had to, because my number was at 12 o'clock, तो करके नीचे आया तो
Dr. Manoj Chaudhary
नाइट वॉचमैन की तरह आ गया मैं.
शोभनी, sorry. शोभानी.
क्या है? हाँ बोलो. क्वेश्चन. अच्छा ओके.
हाँ सर.
हाँ बोलिए ना.
Sir, I'm Dr. Pradeepam Nagpur. This is excellent presentation and out of the academic and something like mythological. My question is simple, sir. Many times we sexologists, the patient comes for ED or premature ejaculations, and we give the normal therapies like PD5, sildenafil, tadalafil, chronic dose or short dose, and they come one visit or second visit. After 2 to 3 months, they stop visiting to us. Okay, so what my question is how to motivate them to complete the treatment or find out the real cause, maybe diabetes, metabolic syndrome, and how to motivate them, and so that we can work on the root causes of treatment. Maybe this is the problem which all the sexual physicians were facing.
Yes. So the answer to this question, number one, as we always say, from the endothelium, that is intima, to intimacy, everything should be practiced. Rather, the word intima comes from the word intimacy only, which means deep and close. Number one. So all arginine वगैरह होता है. Second thing, now we have started realizing that just like diabetes and blood pressure are long-term permanent disorders, some patients might be having a permanent erectile dysfunction syndrome and they need a support lifelong. See friends, we should also tell them, third point, that ठीक है ना भाई, है, कबूल है, okay, you are having all the negative emotions because of that. But asking them or giving them the realization, come on, you are not having mental retardation, your kidneys are nice. So दूसरे का दुख देखने की शुरुआत किया करो, because then the intensity decreases. And the fourth thing is that yes, ideally I also feel that we should call all the clients or the patients and ask that whatever I have given you, okay, to what extent it has benefited you. Completely, partially, because we have the feeling that जो कुछ मैंने दिया, no news is good news, but need not always. And I am of the personal feeling that after the age of 40, okay, 30 and 40, till 40 nature will support you. After 40 nature doesn't support, we have to have some tablets or something. Because at a fundamental level, we have to realize that in 1947, the life expectancy was 32 years. Now it is 84 years. There was nothing like geriatric medicines. Now the data is coming. And come on, okay ना, ठीक है ना, 40-50 साल के बाद अगर गोली लगी मगर तू जिंदा रह रहा है and you can at least to some extent enjoy. So same thing. And the same thing with the dermatologist, we will agree that after the age of 40, see what happens. The aging starts after the age of 28. Till 28, anabolism. 28 to 40, plain. After 40, there is catabolism. So even for the hair treatments, response after the 40 stops or decreases. Same thing is going to happen for erectile dysfunction or other. So we have to tell them that sometimes the erection pure cure is not the aim of the treatment. Then what is the aim? Number one, to decrease the symptom as much as possible. Number two, take the patient in remission. And number three, at least if we are decreasing the frequency, duration and severity of the disease, बहुत हो गया. Because there is, and maybe after a while, maybe 10-20 years down the line, when the genetic and epigenetic engineering will advance, permanent cures might come. We should always be hopeful.
Okay.
Thank you, sir.
Thank you, sir. Thank you.
I invite Dr. Manohar Shobhani, sir, to felicitate Dr.
Have I satisfied you? Means, I mean,
Gadre, sir.
see, in life and in sexology, there is no one answer. I always tell yes or no.
He got the orgasm.
So there are levels of answers. Yeah. Thank you. Thank you, sir.